Hello, this is Dr. Juan Carlos Ramirez, and I am here presenting a rare case of IgA-dominant infection-associated glomerulonephritis after an episode of pneumonia. We present here a case of a 56-year-old Hispanic female with no significant past medical history, recently emigrated from Cuba to the United States about 2 years ago, who initially presented to the emergency department with hematuria and chest pain. On admission, she was found to be septic secondary to a left lower lobe pneumonia. Additional findings at this time included an acute kidney injury, a pericardial effusion, a left-sided pleural effusion, and was found to be positive for MRSA as well in her nares. The patient underwent a pericardiocentesis with a drain placement and thoracentesis, along with treatment for her pneumonia with linezolid and cefepime. Despite the adequate treatment of the sepsis, the patient's renal function worsened, and she developed a recurrent hematuria that prompted a renal biopsy. Pathology of this biopsy revealed proliferative glomerulonephritis with an IgA-dominant deposit and an acute tubular necrosis. These findings suggested that an IgA-dominant infection-related glomerulonephritis was secondary to her MRSA infection, and this was supported by the patient's elderly age, this recent staphylococcal infection, and a neutrophil-enriched hypercellularity with mesangial IgA and C3 complement deposits. The patient was treated with a pulse dose solumedrol, and she was then transitioned to a prolonged prednisone taper, and afterwards, her renal function improved significantly following the steroid initiation. The relevance of this case is that recognizing a rapidly deteriorating glomerulonephritis is extremely important, especially for IgA-dominant infection-associated glomerulonephritis, as it's a very rare condition that typically affects the older patients with diabetes, as well as other patients that get staphylococcal infections or other such infections that have been documented in the past. And what's very interesting is that this form of glomerulonephritis does present with the common symptomatology of an acute kidney injury, hematuria, and proteinuria, but does so within the context of an active or a recent infection. The prognosis of IgA-dominant infection-associated glomerulonephritis can be severe, with progression to either end-stage renal disease or death. According to a pooled analysis that was done back in 2021, about 19.5% of these patients are found to have progressed to an end-stage renal disease, and 14.3% of patients actually expire or pass away from this condition. Although this variant is very rare, the severity of the renal dysfunction that it presents, as demonstrated in our case, necessitates a thorough workup, including not only a renal biopsy, but other such tests that may be able to provide some evidence or some clinical information that can rule out certain pathologies, such as an autoimmune condition, a nephrotic syndrome, or an autoimmune condition as well. As we demonstrated in this case, a thorough workup is golden in terms of getting to the bottom of the underlying mechanism, and from this, we can then put the patient on a proper management and can see a wonderful transition into a wonderful outcome in this patient. This case underscores the complexity of the infection-related glomerulonephritis and highlights the need for a prompt diagnosis as well as individualized care strategies. As you can see here in the figures in the middle of the board, it can show the different immune complex deposits under different pathological microscopes, whether it's the electron microscopy or immunofluorescence, as well as the hemosiderin, eosinophil, and periodic acid shift stain showing the segmental endocapillary proliferation with neutrophil involvement, signifying that this is a recent or signifying that there's an inflammatory or infectious process going on that the body is trying to respond to. Thank you very much for your time. I do appreciate it.